Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Stay Healthy, a program that dwells on health issues in the society. I'm your host, Mariam Salim, and today we're going to address the issue of cervical cancer. Cervical cancer is ranked as the second most cancer in women, not only in Kenya but worldwide, causing most cancer death. It is a real menace as it poses a great burden on women's health due to poor prognosis over the years. Before we continue, let's take a look. Our guest today is Dr. Gatembura, a gynecologist from Lionheart Medical Center. Daktari, thank you so much for gracing us with your presence. It is so much easier to talk about solution if you don't know too much about the problem. So let's start by addressing the problem. Cervical cancer. You know, there's so much myth surrounding it. People say it's inherited disease. Is this true? And if not, could you kindly tell us briefly about cervical cancer?
Thank you, Mariam.
Most welcome.
Cervical cancer, like you rightly put it, it is so common in the world, and there are so many myths, but unfortunately, it's not inheritable. It's not inheritable. It is acquired through our lifestyle, and just to help the viewers to understand, is that in a human, we have so many hundreds of thousands of cells, human cells, which we call healthy cells. And these healthy cells multiply and die at a set rate. But a cell is always said to be cancerous when it multiplies out of control and it doesn't die. So that cell will be said to be cancerous. So cervical cancer comes in when the cell in the cervix or at the cervix multiplies without control and does not die. Because of the accumulation, these cells form a mass, which we call a tumor. And this tumor, because it occupies space, presses on the adjacent tissues. And then it spreads to the locally and then distantly, which we call metastasis. So cervical cancer is real menace, and 90% of the world's cervical cancer is predominantly in sub-Saharan country, Kenya being one of them. And to put it lightly and correctly, in Kenya as we speak, I think it has surpassed the number one, which is the breast cancer. Actually, it is now the most common cancer death in Kenya.
So what is the real cause of cervical cancer?
Cervical cancer, the real cause is not exactly known, but it is known that 99.7% of cervical cancer is caused by HPV virus, human papilloma virus, which is the commonest sexually transmitted disease. Human papilloma virus is acquired sexually. It can also be acquired through contact with the mouth or the anogenital region But 99.7% is through HPV, human papillomavirus, which you acquire through penetrated sexual contacts. And once you've been infected with the HPV, because of your body immunity, it fights the virus. And most of it, again, more than 70% of it disappears, dissolves by its own. It's only 30% that remain in you. And then the 30% now that remains, we call them persistent infection. They can now make changes in their cells. Okay? And then when these changes are made in the cells, then we say that the cell has become precancerous. Precancerous. But fortunately, 70% clear by itself. Cervical cancer, from infection to when it manifests with symptoms, it can take 10 to 20 years. So it is not a short period. And the people that are oftenly infected with the HPV are those that are actually sexually active. Yes. So the main cause of cervical cancer is known to be HPV.
Pylori. So what is the modifiable risk factor for the cervical cancer?
The risk factors for cervical cancer, number one is early sexual debut, the early contact, the age at which a girl has sexual contact. We know these days the age at which sexual debut, or what we call koitake, happens in Kenya, it's well down even 8-9 years. The earlier the contact is, the earlier you get exposed to the HPV, and the longer you are giving your body time to change. So that is one factor. The other factor is having multiple sexual partners, or your partner having multiple sexual partners. Either of you. Because when you do that, you are more at risk of acquiring other infections, STDs, like gonorrhea, chlamydia, herpes simplex, just to name a few. And these may make the cells to be more prone to infection. The other risk factor would be if your body immune is low. And the body immune could be low because of some acquired infections like HIV, or could be you are taking drugs that are taking your immune to be low, like maybe cancer, other cancer drugs, or other medical drugs that could be bringing your immunity to be down. The other one, which is lifestyle, is smoking. Smoking changes the cell's parameters such that it becomes easy for the cell to change. In fact, we call it a cofactor. A cofactor. And like you can see these days, it is unfortunate that ladies have really picked up smoking. In fact, they have overtaken the males. They have overtaken the males. And these that I've mentioned are the major risk factors that would make you contact the HPV.
Briefly, could you tell us how cervical cancer is being diagnosed?
The diagnosis of cervical cancer, I would first and foremost try to take the audience through cervical cancer, in that cervical cancer can be divided into generally two stages. The stage before cancer and the stage after cancer. The stage before cancer, we call it precancerous stage. And the stage after cancer, then we can call it cancer stage or overt cancer stage. For us to be able to diagnose cervical cancer, number one, we've got to do the screening. Through screening. And the screening modalities that are there in Kenya we have what we call VIA and VIRI, VIA, visual inspection with acetic acid, which can be done at the locals, the dispensary, the health centers, and nurses and all health workers are trained to do that. Okay, you get the result instantly. Okay, all you require to do is when somebody comes and you want to screen, you do visual inspection, you use acetic acid to do that. Then you can also use Rugose iodine. We call it visual inspection with Rugose iodine. You get the results immediate. The other screening modalities you do is pap smear. Pap smear. Which is the most common one. Which is the most common one. Unfortunately, pap smear is more expensive than VIA and VIRI. VIA and VIRI can be done en masse, can be done to the mass. But pap smear can only be done by those maybe who are covered by insurance or those who are well to do. But it is the commonest method. Once you do the pap smear, the result will not come out immediately. They will take a number of days, because whoever is taking the pap smear will have to send the pap smear to a pathologist for interpretation. So you can get your result maybe after 48, 72 hours. And then from there you can get the results, which I think we will be able to discuss thereafter. Because once you get the results, if you can allow me maybe to just finish that. Once you get the result can either be normal pap smear or abnormal pap smear. Abnormal pap smear means that the virus has made changes at the cervix. And that abnormal pap smear now can be subjected to further tests. And the further tests that are done is to look at the cervix using a microscope. You look at the cervix using a microscope. That process by itself is called colposcopy. During that process we call colposcopy, you look at the cervix using a microscope, and when you find the areas that have changed as a result of the HPV, then you take a specimen, which we call a biopsy. You take a specimen, which we call a biopsy, and then you take this specimen to the lab. Once you take this specimen to the lab, the pathologist, you do what we call histology. And then it is the histology that will confirm whether you have cancer or not. Okay? The only diagnostic method for cervical cancer is histology. It's the one that will confirm that you have cancer. Okay. Before I forget, the other screening modality is the current screening modality. We do DNA testing for HPV, the presence of the virus itself. HPV testing. HPV testing is used as a triaging test, all right? It's a triaging test, and it is used together with the pap smear. It is done together with the pap smear. And it is after then you get a specimen, you take to the lab, you get a histology, then you be diagnosed to have cancer. Okay. Pap smear does not diagnose cancer. It's a screening modality. It tells you, oh, we have a problem here. Can we take it further? Okay. So you do colposcopy. During colposcopy, you take a specimen, which we call a biopsy. Then you take it to the lab, you do histology, you are confirmed to have or not to have
cancer. Okay. Well, for any question, inquiry or suggestion, please reach us through our social media platforms and give the exact links available and active. We'll be back after the short break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our second part of the show. If you're joining us, this is Stay Healthy, a program that dwells on health issue. And today's topic is all about cervical cancer. Daktari, before we went for the break, we were talking about the diagnosis of cervical cancer. Now, could you kindly highlight some of the symptoms of cervical cancer?
Thank you. Mariam, this is very, very, very important because this is the only way that one would suspect that you have a problem. I'd want to put it from the outset that the precancerous stage of cervical cancer, the precancerous stage of cervical cancer has no symptoms. The precancerous stage is the stage where you have the infection. It has no symptoms. It is symptomless. The cancerous stage is where you have the cancers, where you have the symptoms and the signs. And some of the symptoms are you have what we call postcoital bleeding. After sexual intercourse, you bleed. That's not normal. Again, you have pain during sexual intercourse. You have pain in your pelvic region. The other symptom is that you could be having excessive pervaginal discharge, which is smelly and bloody. Excessive pervaginal discharge, which is smelly and bloody. And the moment you find that, and then you suspect that there could be a problem. Okay. And then from then you come to us, and then we can do that. We can do the diagnosis.
So you mean if you have not taken the test, you cannot know if you have cervical cancer apart from the symptoms which you have just mentioned?
The precancerous stage has no symptoms, and that is why we stress on the screening modalities, because there are no symptoms. You didn't know. It is through screening that you'll be able to pick up the abnormal tests, and then you are taken further for more diagnosing. But when you get the cancer, then you will have symptoms. And the symptoms, like you have said, is pervaginal bleeding after contact, right? After contact, you could be well during your sexual active years or in menopause, and you after contact you are having bleeding. That is not normal. You could be having painful penetrations or painful pain during sex. You could also be having painful, the lower abdomen is very painful. And again, the discharge, which is very smelly and also bloody. That can only occur when you have the cancer. But the precancerous, you have no symptoms at all.
Okay, now, Daktari, how long does cervical cancer take to be fully developed?
From the acquisition of the HPV to when maybe you get a full-blown, remember I took you through the cycle, is that after the infection, it may take you 10 to 20 years for conversion. 10 to 20 years. Yes. So you could get infected today, and you will get the cervical cancer in 20 years. But remember, it is not a must. 70% of the infections clear by themselves. Okay. The 30% that remain, again, only about 10% will now progress to invasive cancer. And it's a long period that you are given to sort yourself out. So it is this time that you should take advantage of doing the screening modalities. All right? The screening modalities to diagnose or to see whether you are well or you have any cells that would otherwise become cancerous in future.
Should one consider preventive surgeries if she has a factor for developing cervical cancer?
Like we highlighted the risks for acquiring cervical cancer. All of them are lifestyle. And cervical cancer is not hereditary. It's not passed on from generation to generation. It is your activity. It is your activity. So there is no room for surgery that is preventive surgery, such that you think that since you have multiple sexual partners, you do a surgery to remove the uterus and so forth and so forth. There is nothing like that. Do the screening modalities and then you attend to the problem, because in early stages it is curable. So you do not have to go for surgery. Early stages, abnormal pap smears, early stages of cancer, it is completely curable. So why do anything preventive? There is no room for preventive surgery.
Okay. Now, Daktari, if we shift our attention to now treatment, apart from surgery, what other therapies can be used to treat cervical cancer if once it's diagnosed?
I'll still take the two groups, the precancerous and the cancerous stage.
Okay.
The precancerous stage, once you do VIA, once you do VIRI, that is visual inspection of acetic acid, visual inspection with Ruggles iodine, and you find that they are abnormal. And something is suspicious, then you refer that particular client for pap smear. If you do a pap smear, it can either be normal or abnormal. For the normal ones, you advise them to rescreen later. For the abnormal pap smears, then you go and do colposcopy. Colposcopy. The colposcopy is to confirm whether you have cancer or not. If you have abnormal pap smear and the histology shows that it is not cancer, then we have treatment modalities like cryotherapy. Cryotherapy is burning the cells with cold, like freezing the cells. Okay. Cryotherapy. Cryotherapy can be done at the time you are doing colposcopy. So that is one treatment modalities for the abnormal pap smears or abnormal VIA and VIRI. The other treatment modalities is what we call LEEP. L-E-E-P. Right? LEEP. LEEP is using electrical loop to take off the layer of cells that is abnormal from the cervix. Okay. And the moment you do that, you have cured the problem. You have cured the problem. If you diagnose that this lady has cancer, there is no room for cryotherapy, loop, or other modalities that I haven't mentioned. There is no room for cryotherapy or LEEP. Now, you take that particular patient and you do what we call staging. Staging is taking the client and then take the client to theater and do what we call examination under anesthesia, and then you stage 1, stage 2, stage 3, stage 4, depending on the extent. Maybe I don't have to go into the details of it. Okay. If early stages like stage 1, which is also subdivided to inner details, stage 1 up to early stage 2, that is amendable to surgery. So that early cancer, you can do surgery, which we call hysterectomy. And the type of hysterectomy is radical hysterectomy, so that you remove the uterus plus the cervix, plus a part of the upper vagina, plus the draining lymph nodes and the tissues that are out there. So early cancer, stage 1 and early stage 2 is curable through surgery. If through EUA the stage is advanced, that is the later part of stage 2 up to stage 4, it is advanced, then that particular individual is not amendable to surgery. Okay. Because surgery wouldn't help. So what you do is you do what we call radiotherapy and chemotherapy. Why do you do radiotherapy? You do radiotherapy to shrink the tumor size and to kill the cells that are local.
Local, you mean the surrounding?
The surrounding cells. But unfortunately, there could be cells that have gone beyond the local region. How do you reach to the cells that are either in the liver, in the brain? That is when chemotherapy comes in for the advanced chemotherapy. Because chemotherapy, you are doing it systematically, so it will be able to reach the cancer cells in the brain, in the liver, in the lungs, and so forth and so forth. So in all stages of cancer, from stage 1 to the advanced, after doing the surgery in stage 1, we also give what we call adjuvant radiotherapy to the ladies after the surgery. Why? Because following the surgery, there could have been 1 or 2 cancer cells that may have remained. After removing the uterus and the cervix, there could have been 1 or 2 cancer cells that may have remained. And you want to kill all of them. So that is when now you invite radiotherapy to kill the local cells. But since these cells have not spread, you don't give chemotherapy. But in advanced stages, there is no surgery, but in them, you do radiotherapy and chemotherapy.
Okay.
Yes.
Well, Daktari, let us take a short commercial break. When you come back, you'll give us the side effect of the treatment we just mentioned. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to our third and final part of the show. This is Stay Healthy, a program that dwells on health issues. Daktari, before we went for the break, you were talking about the treatment of cervical cancer. Could you kindly tell us the side effect of each treatment we just mentioned before we went for the break?
Thank you. It is true that most people, whenever they are told that they have cervical cancer, they think that their life is doomed, and they think that all has gone berserk. I mean, and is a road to death.
Okay.
Even though all of us eventually will lead there, but they think that now it has been, it's going to be faster. The treatment modalities, depending on the stages of the cervical cancer, if we consider the precancerous stage, okay, that is the cryotherapy, the lip, we have something else we call the code knife, and so forth and so forth. During the precancerous stage, the cryotherapy, it doesn't have any major side effect as such. Maybe a lady would only have maybe some discharge for 1 or 2 days after the cryotherapy. It's a bit discomforting when you are being done, okay? But it's something that will be done in the office and you go home. Lip, again the same. It's a procedure that will be done in the office. It's an office procedure. It will be done in the office and you go home. It doesn't have any major side effect.
Okay.
And the only thing that one may have again is after the procedure for 1 or 2 days, you may be having some brownish discharge, which you are advised, which you are cancelled and then advised that you expect something like that. At the level of the surgery now, this surgery is extensive. That's why we call it radical hysterectomy. And just like any other surgery, which is a major surgery, we have side effects from anesthetic complications, or complications following surgery per se during the operation. During the operation, like anybody else, we are human, you could have an advertent trauma. Trauma to the organs that are near there. And the organ that is really feared is the ureter. You can have injury to the ureter, or again injury to the vagina, obviously, and then you can get what we call fistulas.
Okay.
Fistulas. After After all is done, you find that a lady is just leaking urine or feces. You can have fistula because there is injury to the bladder, injury to the vagina, injury to the ureter, and injury to the rectum. And then you get fistulas. The other complications, just like I said, are complications for any other operation. You can bleed a lot. All right, you can bleed a lot, and then obviously when you bleed a lot, if everything else now follows. All right, but the client is often cancelled and prepared adequately for the operation.
Okay.
During the surgery, the uterus and the ovary is removed, and depending on the age of the client, because like we all know, cervical cancer, the peak age of presentation is anywhere between 35 and 45 years.
Okay. 35
and 45 years. And 35 and 45 years are relatively sexually active ladies. So the moment you remove the cervix and a part of the vagina, depending on the stage of the cervix, then there could be what we call sexual dysfunction. In that the penetration and the length of the vagina may have been shortened a bit. So it brings sexual dysfunction. The lady may feel like she's devoid of something. Something has been removed. And in her mind, they tend to have some depressive episodes, and it affects their sex drive and their lubrication, and in a nutshell, they get sexual dysfunction. So they require to be cancelled quite well. Again, during the operation, the ovary is removed. And once the ovary is removed, it's the ovary that produces the hormones that makes a lady be a lady as we see them. So the moment you remove the ovary, there are no hormones being produced, and therefore we have created a state of menopause. Okay, so the lady becomes menopause, and hence the drying, the skin changes, the mood changes, and therefore compounds the whole thing of sexual dysfunction. And then following that, we do radiotherapy. Radiotherapy is intense, and it kills the cells and it kills the tissues. So the tissues is like they merge together like that. And they have their own problems in that there are many sessions, like maybe 21 sessions or so. And during those 21 sessions, the cells and the tissues are really like it's like burning a tissue. So the tissue is brought together like this. So you can imagine your pelvis being brought together like this. You can imagine your vagina with your rectum like that. And these people are really prone to have infections. Commonly they get discharges, and they also can get fistulas. Vesicovaginal fistulas, recto-vaginal fistulas, and then there is leakage. So a lady may be on Pampers.
For the rest of their life, or for just a duration of time?
Maybe during that time, maybe she is having radiotherapy, or even thereafter. Chemotherapy, again, these are very strong drugs. These are very strong drugs you are taking. And they have side effects to the organs, the internal organs, without having to go deeper into them. They kill the cancer cells. As they are killing the cancer cells, they also kill a few of the normal cells. The normal cells. So this individual may also become less of blood, and the immunity is so low such that they become now more amenable to other infections, which we call opportunistic infections. So chemotherapy, the main problem is that it lowers the immunity, it such that you are not amenable to opportunistic infections, and again they kills the normal cells such that you require to be having transfusion on and off.
Okay, thank you so much. Dr. Could you now address the issue of preventive measures? According to WHO strategy of eliminating cervical cancer by 2030, they opt for girls by the age of 15 should be vaccinated by HPV vaccine, and that women who are at the age of 35 or 45 who are sexually active should be undergoing screening. Do you think this procedure, it can work to eliminate the 70% of the cervical cancer come 2030?
Mariam, it's true, it is possible.
Okay.
Because as we speak, like what we said at the onset, is that cervical cancer is so common. It is ranked number 2 worldwide, number 2 worldwide next to breast. But somehow in Kenya it's reversed. It's our number 1 to breast.
Okay.
Why? Because the preventive measures we don't do. And which are these preventive measures? Like now, the outside world, like the well-to-do countries, it is very rare to find a lady with cervical cancer. The preventive measures, we have primary and secondary prevention. The primary prevention is where you prevent a lady from acquiring the HPV. And how do you do that? You advise the girls to stay long, to abstain, such that the sexual debut will come much later.
Okay.
You counsel them on faithfulness, not to have multiple sexual partners, both boys and girls. You advise them not to smoke. Not to smoke. The other thing you do is that upon attaining age of 21 years, or upon starting to have sexual activity, they have to start doing screening modalities, like we said, via, VERI, and pap smear. The pap smear, a lady below allowed 30 years, about 30 years or 21 to 30 years, can do a pap smear every 3 years.
Okay.
Every
3 years.
Every 3 years. Below the age of 35, according to the WHO, the HPV testing may not be necessary, but depending, because it is a bit expensive. HPV is expensive, not less than 7K. It's expensive. So in your lifetime, if you really have to do a HPV testing in your lifetime once, then do it between 35 and 45 years. But the commonest preventive measures are the screening modalities, the VIA and VERI, which can be done at our dispensary and our health centers. All right?
Okay.
So you do not have any reason to say that you cannot afford pap smear. At the level of the dispensary and the health centers, you can do VIA and VERI, and then from there they can refer you for pap smear if it is abnormal. Pap smear is generally widely taken. It's widely taken, and then from there you can now prevent the precancerous stage. And once you prevent the precancerous stage, chances of you going to the cancer stage is low. Again, early detection, early diagnosis. The moment we, the doctors, diagnose the problem early, because you are doing screening, you diagnose early. Somebody comes with the symptoms, you diagnose early. Stage 1, early stage 2, it is curable. So chances of you going to
Stage 3
invasive cancer are low. Who is eligible for pap smear? Is that lady who have attained 21 or a lady who is sexually active? There is some people who think because they are not sexually active, either by way of they have separated or they are widowed, and they do not have to do pap smear. No. Whether you are widowed or separated, or you do not have a partner, and you have had a sexual debut, you continue doing pap smear because you were exposed, and you continue doing pap smears as advised every 3 years, and if you're above maybe 35, 45, and 50, you can do it every 5 years. And then you stop doing at around 65 or 70 years. So the fact that you have reached 50 or 55 and you find you are not active, you don't say no to the pap smear. Then you continue doing the pap smears. And by the way, if you have had surgery as a result of cancer of the cervix, you still continue doing the pap smear after the surgery.
Okay.
The other preventive measure is the HPV vaccine.
Okay.
HPV vaccines are 2 types. Like we put it, is that the HPV vaccine, the HPV virus is the causative agent. HPV virus, we can have more than 100 variants of HPV. Then the HPV virus can cause many cancers, from the throat, the penile, the anal region. They can have many, they can cause many cancers.
Okay.
They can be divided into 2, high risk and low risk. The high risk HPV virus are the ones that cause cancer of the cervix. All right? 70%, there are about 15 high risk HPV viruses. And out of the 15, about 2, 16 and 18 are the ones that cause cervical cancer, 70% of the cases. The rest, 6 and 11, may be causing a low risk, and they may cause the genital warts. Okay. So the vaccines that are made are of 2 types. Vaccines that are geared towards eliminating 16 and 18, and another one which we call Gardasil, that eliminates the 4 of them, 6, 11, 16 and 18. Okay. So there is one, the Cervarix, 16 for 16 and 18. There is another one for the 4 of them. So if you are given the 4 of them, for the 4 of them, it not only prevents cervical cancer, it also prevents the warts, the genital warts. If you get the Cervarix, it only prevents the cervical cancer. The vaccine, as we speak in Kenya, it's given to girls only. It was rolled out 2013, but I think the government introduced it well about last year, whereby the recommendation in Kenya is that we give girls who are anywhere between 9 and 13 years, but it can all go up to 26 years. That is before sexual debut. You give the cells. The Cervarix is in 3 doses, although these days they are introducing one that can be given in 2 doses 6 months apart. Okay. But the Cervarix is given at day 0, day after 1 month, then after 6 months. Okay. If you are going to be given Gardasil, the same thing. Day 0 after 2 months, then after 6 months. Okay. The research hasn't showed us that you require a booster dose, whether you don't require a booster dose. But the vaccine will cover you for some period of about 8 or 9 years. But by that time, you have gone beyond maybe 30, 35, and then you continue doing the pap smear. The fact that you have had the vaccine does not preclude you from doing pap smears. You continue doing the pap smears. Outside Kenya, the vaccine, now like the well-to-do countries, has been rolled out even to the boys. Okay. I hope and pray one of these days, even us, which are roll it out to them.
Okay. Daktari, thank you so much. Indeed, it has been a pleasure hosting you on the show. Well, that marks the end of our show today. I've been your host, Mariam Salim. Join us next week. Bye-bye.